David.
Hello.
I'm right behind you.
I heard you coming.
How did you know it was me?
I didn't know it was you.
Till now, right? I could have gone around you, but I decided I would just watch you walk.
Staggering.
No, you walk very well.
Oh.
You gotta stop apologizing, period. If you apologize for the way you walk, what about the way I walk? I think around a lot more than you do.
Well, I thought of an electric chair.
I know you have.
More recently, just because my knee is just getting worse and worse.
And you know how I feel about that.
Well, I'm glad you indicated that, because I had thought differently, because you could go to a table.
This kind of chair is designed for somebody with and the kind of chair that she had was designed from one place to another. Like, that's the people who go when they're from dining room, both places. It's harder to, it's possible to get that, but it's harder to use it. Of course, it's harder to use the bathroom than this one is.
Flipper is about the same.
Yeah. But this one, you can get up to the table, you can get into the bathroom, get around, you can turn on the dime on this one. And I have to work where the dime is. I mean, if I go right out there, I could go right, without losing. I can work there, it's learning for me. I get in the elevator, I think of driving in something like a car, steering. And all I have to do is go to the middle of the elevator and turn around. But the diameter in front of the turn behind is the same. But, you know, is your need increase the possibility of a fall?
I don't really know.
One way to find that out is that fall.
I don't know how we're going to be stored. The chairs are every direction. I can't figure out. I can move it, but
You might have to see what it is.
how do you do it?
As I do,
I just let it go.
then you are.
We started to talk, and you said you better have
I use this, I'm pretty sure that I can go on my walls
It says
and
there are
that.
no masks.
Well, I know it, that's what I brought this, my watch.
Well, we have to wear.
If I come back, and
I stopped in the.
spend all the rest of the day. And that was a big virus of all my part.
When I keep it, I put
Away, you know, so I'm just preserves the health that I have. Yeah. That's right. That's it.
it just,
It's one thing after another as far as.
That's what it's about.
we don't know how, where are we gonna sit, where shall we listen, how shall we listen?
Well, it's still weird.
Shall we go in a circle or,
Well,
well, how shall we sit? Are you gonna stay at the mic, go to the mic?
I think so.
Okay.
Brian will be up there, and I'll get the rest of you are getting the most of the game.
Well, there was a circle back here.
Probably.
Yes, it is.
Yeah,
There's a phone number back there.
it's a bingo group.
Not me.
Another group back. We'll have to arrange the chairs for us. And they are arranged for us, I think.
Oh, good.
I don't know when you're gonna have our dinner.
Are you getting ready?
Well,
I thought of it as I came down the hallway.
I'm thinking about it, but
I found it, I found our instructions.
yeah.
I got it, I just came, found it in my drawer.
I think it's getting closer. I don't know. There was a thing today was that they're changing some of the rules and legislation and stuff. Well, I didn't see the memo for today. They didn't say very much. But I think he's gonna be, all the kids have dining at the same table in the dining room.
They say it's gonna be up there.
It's not gonna be long until they're allowed to walk around my apartment. So,
He says, I run out of parts. We never gonna get there. We're planning on
hi, Monty. How are you? I found out through the grapevine that Gene Anderson very what was this? He just decided we had to go. Okay, hello, let's go.
Head right up here, and you can be mask free. I, however, have to
You're not vaccinated?
Oh, I am, but employees are supposed to be.
You can't take it off in here, even for social distancing?
No, employees have to keep them on all the time, so
I can't see what.
this is where we are.
Okay, that's where we are. And the regulations I support, because not all of them, but they apply to everyone. And they have kept us in healthcare facilities healthy.
That's right. I just realized these lights aren't on. I want to turn those lights on. We'll show up better on the camera.
Okay, please do.
Right.
I don't know what we can do about the placement of the microphone and chair.
You want me to move it up a little bit?
I'd like you to move it over here so I can see the audience. And then you sit over here.
Okay.
Then I could see the people who are set over here generally. I want to be able to see them.
Oh, well, that's fine.
Or maybe right in the center, you know.
Okay. And I'll bring the bed over.
Most of the people are on this side now, and for some reason or other, most of the people usually sit on that side. We can direct them all to sit on that side.
Sure.
The more they sit in one location, the better.
And I'll need to adjust the camera now.
Okay, go ahead.
Alrighty.
I'm just doing that to make it hard for you. Tim, sit over on this side if you guys can. If you can sit on this side, it's better. If you can sit more on this side, it's better. Then I can see all of you without cleaning my neck. Okay. Yeah, you can sit in the middle. You can sit in the middle. That's okay. Sit in the aisle.
Oh, he's afraid of me. He won't sit. He's afraid of me.
David, you can sit there. You're special.
They're all afraid of me. They're all afraid of me. I'm gonna bite them or something.
Well, good afternoon.
Good afternoon.
It is time to get started. I wanted to make mention of one thing a couple things, I guess. You already picked up, you may have heard me say, you can take your masks off.
You take your mask off when you're on the other side.
But I can't, I'm not allowed to take mine off.
Why?
Employees have to keep their masks on all the time.
Makes it hard to hear you.
Sorry. Is that better? But that's one thing. So Wilbur's If I guess if it were me, I'd rather have Wilbur have a mask on than me.
I'd rather have my mask off, though.
Also, Heather Cruz will be here in a few minutes. One of the new things we have to do, since this is going to be on Channel 3, is we have to have like a media consent form that says that you're okay if you happen to show up on Facebook or on Channel 3 where people can see you, you're okay with that. So she'll be back with that paper and she's just going to pass it around, and if you're not okay with it, that's okay. Just say you're not okay with it. That's not a problem either. So also, I thought I should explain this apple. I had a supper last night with some friends, and we went to Panera up in Fort Wayne, and I couldn't eat everything. I couldn't eat my apple. Well, I left my apple in the car all night long, which was fine, and then I thought it's supposed to get hot out, which it is today, so I decided to bring my apple in because it was gonna, but then it sat on my desk all day, and now I'm leaving after this, and I still don't have any use for my apple, so
You're carrying with you.
I'm carrying it with me, although I shouldn't have, because, you know, an apple a day.
Yeah.
Keeps the doctor away. Yeah.
Well, we are here to talk a little bit about experiences that Wilbur's had, and maybe through some questions and answers, maybe some that you've had, as far as the transition back and forth through or to healthcare, and what that's like and what some of the implications are. And I think everybody here knows you, Wilbur, but there may be some people watching on Channel 3 who don't know you.
Okay.
So you just give a little introduction of yourself.
I'm Wilbur McFadden. I'm officially 90 years old as of 13 days ago.
Well, happy birthday.
And I have lived at Timbercrest since 2004, 7.5 years on Oak Drive, and the rest of the time here, almost 10 years in the Manor. And of that time, that's what, 17 years?
Yes, about, yeah.
Yeah. I've spent more than a half a year in healthcare.
Wow. That's,
The details later on.
yeah, that's right, that's right. Now, yeah, I'll move the mic a little, they're having a little harder time hearing.
Okay.
Move it up just a bit there.
Okay, now can you hear better?
Yeah, we want to project a little bit too.
Can you hear better? Can everybody hear?
Heather, can you turn it up a little bit? Just, yeah, we had a hard time with chapel, but Heather, who just came in the back of the room, she's a hero or a heroine. She got it fixed in time for bingo, not in time for chapel, but in time for bingo. So.
First things first, right?
Right.
First, I'd like to ask a question of my own. Of the few of you that are here, how many of you have spent time in healthcare?
Well,
Okay.
more than half.
More than half. There's 5 out of 7, 5 out of
8. Yeah.
8, yeah. So, some of you have had experiences you'll have to be able to decide how they match up to mine.
Sure.
So,
Well, the first question I had asking you was actually from a perspective probably none of us have, and that is about your perspective as a physician.
Well,
what the purpose of long-term care actually is, and what the purpose of healthcare actually is.
Timbercrest opened in 1968 or 67? 68.
Yeah.
And I started taking care of patients here in healthcare in 1969. So I took care of patients in healthcare for 30 years. So I have that perspective.
Sure.
My mother was at Timbercrest for 15 years, and she spent the last 2 years of her life in healthcare. So I have that perspective of my mother being in healthcare. I was in healthcare, I told you, for 30 weeks, My wife was in healthcare less than that, but she was in healthcare 2, I think, times, maybe 3. I think maybe 2. I don't know. I've lost track of exactly that history. So I have the perspective of family members, friends, myself, my wife, my mother, and patients in healthcare.
Yeah, that's really what a unique perspective that is.
Now, you ask about the need and I think we all recognize that we're at Timbercrest because we know that healthcare is here and that Crestwood is here. We don't like to think about it. I can't think of anybody in healthcare or Crestwood that planned their life so that they would end up in healthcare. You know, that's not part of the master plan, but it is a fact of life. In fact, I don't know where what age group this data was accumulated or found, but we spend on average at our age more than 1 year in healthcare at the end of life. And we don't plan on that, but that's a fact, you know. And we moved to Timbercrest because that's available. You know, we don't opt to go to a nice fancy condominium someplace without health care, because we know health care is it's a necessity to have continuity of care.
Right, that's right.
No.
Well, I think that, that what you just said is really an important thing. My father will be 84 in July, and they live in a condo right now that is exactly as you said. They both have health issues now, and guess what? They're having to move. They're going to have to move to a place. They probably won't go to healthcare right away, but they're going to go to an assisted living place. Yeah. Because like you said, the choices they made, that's not available where they are. So they have to make a major move, and that's.
Some of you know my son Dan and his wife Wendy. Wendy's parents lived in the same home for most of their life in Maryland, and they didn't like to plan ahead. I mean, they didn't like to think about never living there. And when the time came that they couldn't there, it was very difficult planning and decision on their part. And Wendy's mother ended up in a healthcare facility in Maryland, and her father ended up in a different facility, well, not real close by, but maybe, but it wasn't a good situation, and it ended up eventually Wendy's sister bought a house down in North Carolina where their church had a facility for living, and took care of them. Because that was better than where they were living. So it wasn't a good situation for them for several years in transition. And that happens. Well,
when you talk to people, whether it's people in the 90s Club or people in the community or maybe some of your former patients, what are some of the fears people have about moving to healthcare or really to any skilled nursing facility?
Well, the skilled nursing facility is the end of the road in a lot of ways, and they know it, and we know it. You know that's what happens, and they don't like to think about that. The two biggest fears that older people have as they grow older are loss of control, and that includes control health issues and control financially. And the other one is of unmanaged pain. Now, pain is not the issue it used to be, because that's easier to manage than it used to be. And it is managed better than it used to be. So that pain, if that's on your list, that's easier to take care of in a skilled nursing facility than anywhere else, because you have changes that can be made right away, and medicines that can be prescribed, and changes that are important. So the big fear is loss of control, and also one of the big reasons is that people have this image of what healthcare is, and they still think of something like the old county farm home. You know, that the healthcare is like that. And I've known people that have had that image and have made their children promise, never put me in a facility like that. And what they have in mind is a facility like that, rather than like they are now, you know. And I've known families and children that have given up all their kind of lifestyle to take care of a mother who demanded that kind of don't put me in a facility like that, you know, thinking of the county farm.
Right. No, that's exactly right. Well, even into the 70s and 80s, there were places where, you know, there were people with 6 or 8 people in a room, you know, you know, and that's just not. And I took care of people.
I took care of people like that in facilities like that, primarily in Wabash at the time. And it took a long time for those to gradually modify and change their facilities and change the kind of care they give.
Yeah. Well, before I worked here, I worked at Miller's Mary Manor in Wabash. They're on Manchester Avenue before they moved. And we had 2 wards. One had 6 rooms, 6 beds, and one had 8 beds. And that was in 1996 or 7, you know, so it's not been that long ago.
No, it's not that long ago. And I took care of patients at the same place there, you know, and saw it modify over time, but they were always more congested.
Right.
And there was more odor associated with that home than usual. So.
Right. Well, we have things here that a lot of places don't have. You know, every room, almost every room is private.
Yeah, I know.
You know, and that's a real thing. A lot of places don't have that.
Yeah,
you know, so,
and they don't even have the ability to do that.
Right.
Yeah.
That's right. Well, it was really part of David Lorenz's vision for Timbercrest. It was really part of his vision for us to have that, to get to the place where everybody had, except for like the married couples. We have some groups like that. But,
that's a big advantage.
What do you think that we can do as Timbercrest? I know we're preaching to the choir a little bit here, but what kind of things can we do as Timbercrest to allay people's fears about moving to healthcare?
Well, this is one thing.
Yes, that's right.
Is to talk about your own experiences in this, and to find ways to know what those fears are. And address them, I guess. Everybody's fears are a lot of times based upon incorrect information. And they might be based on previous people's experiences or even families' experiences, and they don't want to have that same kind of experience. And that's, you know, if I base my opinion on my mother's experience, and only that, I would have an opinion that has been changed over time, and I might not know it, you know. You know? And now she had a good experience. I don't mean that was that, but a lot of times our experience in a hospital is based upon a single incident that might have occurred in that hospital by them or a friend or something, and that colors the whole institution, whereas it might have been related to one nurse or one doctor, you know.
Right.
And I've heard people have an opinion about Parkview or Luther based upon a single one incident experience. You know.
Yeah, that's right.
That's probably true in healthcare here, you know. So.
Well, it's even true of restaurants when you think of it. You go to a place and you get a steak that's got a piece of gristle in it.
You don't go back.
You don't go back. You know. So yeah, but it seems like healthcare is a lot more of an important decision to make than just that. I wanted to ask you a little bit about your experience as a caregiver. When Joyce was in healthcare and you, I mean, obviously the nursing staff were doing most of the labor, but that puts you in a position of caring in a different kind of way. How was your experience as that? Did Timbercrest help you with that, or was it?
You mean when she was in here?
Right.
Well, they took care of her while she was here and took care of her needs. We had an unfortunate experience when I was in healthcare with a sprained back. I couldn't get out of bed on my own, and I needed to be there for 3 weeks. And Joyce came in because she couldn't stay alone, so she came in as a private payer. And 3 or 4 days after she came in, she had a fall. Now, all falls are preventable by definition. You know, all accidents are preventable by definition. And her fall was preventable. It was unfortunate, but she broke her ankle. And that turned out to be the domino that caused her death. You know, she had that fixed, and then had a heart attack right after that, was in the hospital 10 days, and then came back and lost a lot of weight and died a month later. So that was an unfortunate incident, but stuff happens, you know, and I knew that, and I didn't hold Timbercrest accountable for that because stuff happens.
Right.
Yeah, and I knew that, so.
Was your experience with our nursing staff and our food service and housekeeping in healthcare, was your experience positive?
In general, yes. You know, this last time in the hospital, I was in healthcare for about 9 weeks with a broken hip, and things are in transition now in nursing care in all hospitals and places like this. There were a number of agency nurses, and I ran into agency nurses for the first time in Huntington Hospital when I was there when I had my hip repaired. And an agency is a nurse that is employed by an agency, and a hospital leases them or pays them to come to the hospital and fill in. And I never ran into those 3 years ago. But there are a number of agency nurses now in the care, in hospital staffs and nursing home staffs. Right. And it's a fact of life. It's a transition. It's the nurses like it. It's more cost effective for them. They get paid better wages, but you have to get nurses. So agency nurses are important. I think there's more turnover in the aides than there was even 3 years ago. When I was in the hospital 3 years ago with a broken leg, I had aides that were pretty much the same for most of that time. This time, the aides seem to be more in transition too. A nurse is a career path. A CNA is not a career path. Right. And a lot of those are young people, and they move on to other places. Now, we also at Timbercrest live in an unfortunate environment one way. Peabody Home and Timbercrest are both big nursing homes and healthcare facilities, and they share the same small number of population to get staff, and they always have. Mm-hmm. So getting staff and maintaining staff is difficult in that environment. You can just think about it. You know, if this place were in Fort Wayne and exactly the same, we'd have a much bigger population to draw staff from. It wouldn't be quite the competition or the cost, but it's a big factor here.
Sure it is. It is. And the agency nurses, I mean, they do actually they do a very good job.
Yeah, that's true.
We depend on them.
I know.
This whole, especially since the pandemic, the trend was going that way, like you said. But since the pandemic, it's just a lot of, especially the CNAs, like you mentioned, they don't want to work for what any place can afford to pay them. And I was coming to work one day up State Road 15 to come over this direction from home, and there's a giant billboard that said for Zimmer up in Warsaw, come start working here at $18 an hour, no experience necessary.
Wow.
Well, somebody that's working here for far less than that, you know, you see a bulletin board or a billboard like that, and you're, you know, they don't have to put up with all the regulatory hassles that we've had to deal with, and And that's been attractive to, unfortunately, an awful lot of people who work here, some who've been here for a long time, you know.
Zimmer has been, yeah.
No, well, not just
the
Zimmer.
higher wages, yeah.
Yeah, Zimmer, the Chrysler and Kokomo, any of those big employers, they just siphon off.
That's how the marketplace is supposed to work.
That's right.
And that's the way it does work.
Right. Well, and we're in a tough spot here of, we pay well.
Yeah.
You know, the CNAs and the nurses who work at Timbercrest and Peabody are paid far better than those CNAs and nurses who work at a place like Miller's Mary Manor.
Yeah.
You know, we do stay on the top of that, but it's still tough.
Yeah.
But the trend, that was one of the questions I asked you on. We have a cheat sheet here.
Yeah.
But one of the trends that I wanted your opinion about is home care, and a lot of people are looking at, instead of coming to a place like Timbercrest, they're going to stay home and have somebody come in and take care of them. And what's your take on that? What do you think?
Well, I know there's a trend like that, but I don't know how important that is. You might be more aware as part of the management team here how important that is in people making decisions to come. But it's a trend that's been going on for a long time to try to find a less costly way to take care of people, for one, and then to meet the needs of people staying in their home. And they've done a good job of that in general. They can provide physical therapy in homes. They can provide nursing home care or nursing care that comes to the home. They can provide food services. They can provide aides that come in and do some of the home care, housekeeping, cooking, and stuff. So it's a trend, and part of that trend is driven by the fact that facilities like this cost more than people can afford. I often think about this. When the Mexico Home started, it was the Church of the Brethren initiative to take care of the widows and orphans.
Right.
And the widows and the orphans were the people that just did not have a place to stay, and they had a home for the church to take care of them. It's unfortunate, but it's been true for a long time, that those widows and orphans can't come here anymore. They can't afford it, So, and that's been true for the last 40 or 50 years. Mm-hmm. And when I was on the board for a few years after I retired from practice and before I moved here, it was clear that need of the widows and orphans can't be met, because we can't afford that to give that kind of care anymore to widows and orphans who can't pay the way. Mm-hmm. We wouldn't be here as a facility if we didn't cater to the needs of the people that can afford. We just wouldn't have any facility for anybody. So.
Right, that's it. I asked you, one of the questions was, your son, Dave, who I know, is a baby boomer.
Yeah.
What do you think makes, or what kinds of things can Timbercrest do or healthcare do to address the approaching needs of baby boomers like David or like me?
I don't know. That's, I don't know.
You're supposed to know.
No, I'm not. I'm sure there are all kinds of studies out there, or at least some kind of studies that are trying to answer those questions, ask those questions and answer those questions and prepare for them. But I'm not aware of those surveys anymore and data. But every organization like this is trying to get a corner on that information so they can respond to it, so they can plan and build and ahead of time. But I don't know what that information is. When I was on the board, we had a little bit of that information, and I'm sure the board still gets that kind of information. So,
yeah, I know when Karen and I talk about, our longer term plan is to move in sometime in this is about 10 years away for us, in our early to mid 70s, And sometimes people look at us like we're crazy. You know, why would you do that? Well, we prepared for a place like Timbercrest. A lot of our friends haven't. They haven't even thought about it.
Yeah, that's the problem. People haven't thought about it, you know. I used to deal with people all the time about trying to help push them to make a decision like this, and they knew that was part of their plan, but they didn't like the idea of giving up where they were living or making the decision. And I only know of one person, a patient of mine, who I encouraged to move to Peabody. And she got to Peabody. She lived on a farm for 5 years after her husband died. And she came to Peabody, and she was very unhappy. But I got insight into that, maybe 6 months later. Her son told me, my mom's been unhappy her whole life.
Well,
and that gave me a little insight to what was going on. So
sure.
Yeah.
Well, we have some time here. I wanted to ask, what kind of experiences did any of you have, or about, you know, going to healthcare and then coming back to your home here, and any thoughts or things that you'd like to say? And I could repeat it so you're heard on the microphone, so you don't have to say it very loudly if you want to.
How many of you don't like the idea that you might end up in healthcare?
Anybody?
Don't like the idea that you might end up in healthcare.
I think there's one. There's a couple.
Grace and I both went to there because of the pandemic, and we were tested as positive and had to stay down there sequestered. You know, it was really a different experience, I think. But we were not very happy.
I had a very bad experience. The whole thing was a very bad experience.
But I think it was a different.
Yeah, I reacted to flu one night. The next morning, I stood in my kitchen, and the nurse came in a wheelchair and sat me down, and she said, "We're taking you right now to healthcare." The workers picked up my clothes. They didn't make a list of anything that I had. They just took me, and it was a terrible experience.
Yeah,
It was a very bad experience, and I was there 14 days. I never, in all that time, I did not have a negative reaction to COVID.
Mm-hmm.
But even though my tests were there, they wouldn't let me out for 14 days.
Yeah, that's a couple are I'm just saying this for people that might be watching. There's a couple that are talking about the experience of being sequestered in healthcare because of the pandemic, and the whole thing of what we had to do during that time period was negative. It was an essential thing to do to prevent any kind of spread, but having everybody in their room or in their apartment for months on end was really a difficult thing. That probably drove as many people away as higher wages. The attachments that we as employees make, and then to say, "I'm sorry, so-and-so," and no matter how much you beg, you can't go out into the hallway. That sort of thing just broke a lot of people's hearts.
a lot of that most of that was driven by regulations.
Correct,
Yeah.
That's right.
And by the Indiana State Department of Health and the state. And I had a negative understanding about regulations much of the time I was in practice, because I saw how much they impaired our care, our time to give care here at Timbercrest and at Peabody. Some of the regulations seemed very unnecessary. But then I took care of patients sometimes in very poor facilities. And if they didn't have regulations, they would have been the same regulations, they would have been even worse. They were bad enough as they were.
Yes.
But without, and and the state regulations can't go around and say, well, no, you don't have to obey it, but you do.
Right.
We're not at that point yet, but we might be at a point there sometime, I hope.
Right.
Where there could be a way to earmark or tailor the regulations to those that need them. But I saw nursing facilities that were really poor. Without regulations, they would have been terrible, so.
Exactly.
And you know of some of those too.
I do. I absolutely. We have a couple family members in our church that are in a couple places in Peru.
Yeah. That,
boy, I go in there to see them, and I walk out, and I thank God for Timbercrest.
Yeah.
I just it makes you sad to see.
Yeah, there's poor care can be terrible care. It usually is,
Yeah.
So the regulations make sense, but I think of the one thought I took away from my last time here in Timbercrest in healthcare. I saw how much time was devoted to paperwork. And I thought, if I was ever in position, and I'm never going to be in position, I never was, to do anything about that in healthcare, the first thing I would address is all the unnecessary paperwork. How can you do less on that? Right now, it's insurance driven, but they almost all under the function of, if it's not recorded, it didn't happen. So you can't have any nursing care or medical care. It all has to be documented. And there's a lot of time spent by the CNAs and the nurses and the staff. They're looking at their laptops and computers all the time, entering data. And I think it's unnecessary.
10 years ago, Robin was in the hospital and in healthcare.
Yeah.
And I think we were very satisfied. The meals were nice. Therapy was available. Everything was there that we needed, and I was able to see him and be with him. We had a big plus as far as that was concerned.
Yeah.
I think my other situation was
Definitely.
very unusual, and I have said to the CEO, I hope that if this ever happens again, we have a better way of approaching it and working with it.
Yeah.
COVID established a lot of rules for trying to contain the virus and keep it out of healthcare facilities. And I'm sure that, Grace, when they came for you, they thought they were doing the way the rules had to be. I think they could have bent those quite a bit and gotten the same effect.
I think it was I think I was the experiment, the first, and they didn't quite know how to handle it.
Yeah.
They hadn't gotten there. I understand that.
Yeah.
It was just an unfortunate.
Yeah, it was an unfortunate
Right.
experience.
Yeah.
Let me say that I realized that it was.
But,
I learned from
yeah.
Right. Yeah, that's what Grace was saying there, was that she was, if not the first, one of the first, and we were still learning what to do in that. I did have one maybe last question.
Go ahead.
And this is one I should have asked earlier, but from your perspective as a physician, and I think it would be one that it would be good to know. How do you bring it up to the doctor to say, well, I've got this and this and this going on. Is it time for me to move either to a more assisted part of Timbercrest, or is it time for me to move to healthcare? How does somebody bring that up? Because we've talked about people want to avoid that. They don't want to talk about it. But how do you talk about that?
The vehicle for talking about that now is your power of attorney for health care. I think everybody ought to have, and by this time, most of the people here have somebody designated as the power of attorney for health care. That means somebody, usually a family member, that has the power to make decisions for you. In this health environment, you always have autonomy to make decisions about your own health. But you ought to have a person designated to make those decisions when you can no longer make them, you know? So the person to talk about those issues to is your designated power of attorney, what your wishes are. It's easy to bring up your doctor. I think your doctor is willing to talk about them. Most people, patients, aren't willing to talk about them. That's the problem. Most people are reluctant. What they fear most is loss of control. And beginning to think about healthcare or even Timbercrest means giving up control. And that's what their bottom line fear is, and they don't want to talk about giving up control. So,
right. Well, good. Are there other questions from the group?
I'm just curious about the status, sort of the status, unquote, of healthcare. Are they maintaining the staff numbers that they need and the kind of staff that they need? At one time, I knew they were fairly thin. I don't know how long ago.
at one time it was what?
Fairly thin, the staff.
Yeah.
They were short-handed.
Right, the question is, how are we keeping up with the staffing and
Staffing
with,
of healthcare,
in healthcare?
appropriate staffing.
I think that's been our number one priority of the board for a long time. I know it was when I was on the board in the early 2000s, was staff satisfaction, and that was important for staff maintenance, you know, and we have a thin population to get people from in a place like Manchester or even Wabash County, and it's getting thinner, you know, so that's a number one priority. Part of it is pay better. A big part of it is make it a good work environment that they like to be part of. And I think they've worked hard at that, and I think it generally is a good work environment. But it's hard. It's almost next to being a restaurant. If you have a little bit dissatisfied, heads roll.
Right, that's right. Well, we are at our game. I would say we are at our game. We're holding our own. We're doing well with the staff we have. We are used to excelling. We're used to being overstaffed. We're used to having, they call it a staff to resident ratio of, I think, 1-4 or 1-6 or something like that. One nurse or one aide for that few people. Compared to a lot of places where that ratio is 1-10 or 1-13, and that's not the kind of place you want to go to. We are on the high side of that, but I think we're holding our own. Thanks to what Wilbur mentioned earlier, thanks to agency nurses, thanks to some very dedicated, I don't want to name names because I'm afraid I'd leave somebody out, but we definitely have some long-term nurses and CNAs and people in food service and people in housekeeping who, I mean, they're here, obviously they're here for a wage, but they're driven by the mission of Timbercrest to be a different kind of place than any place else. And as I said, that core of people has really, I think, held us together well. And as I said, I think, and it's good for agency nurses and others to come and go to see that we do things differently.
I know one agency nurse back in healthcare has been there for 2 years.
Right.
She likes working here. She's employed by the agency and paid by the agency, but she works at Timbercrest and likes it. So.
Yeah, that's right. Well, a lot of them do. A lot of them, the thing that they don't like is that a lot of them come from Fort Wayne.
Yeah.
And so that drive back and forth, that's the downfall, but that's one of the obstacles that we face, and Peabody faces too, is that. Grace, you had a comment?
If you notice the report on workers' years of service this month, everyone but one was over 10 years of work experience here.
Yeah.
That's the goal we'd like to have.
That's right, that's right. Well, I had the timer set for channel 3 for 45 minutes.
Okay.
So whether we like it or not, we're not gonna be able to talk very much longer.
Yeah.
But I think it'd be nice if we thank Wilbur for his time and his insights. Thank you very much.
You're welcome.
And you want an apple?
No.
You sure? Anybody want an apple? I don't know what to do with this thing. So I'll go.
Eat it.
I think I will. It's so. Thanks for coming, everybody.
Brian, okay, you gotta turn that off, okay.
What's that?
Oh, this is just ending, and then it'll go back, but I haven't turned the camera off in that, so I'll be right back up. See you later. Can you sign this paper? Yeah, let's first.